Are you currently shopping for a Medicare Supplement or what's called a medigap policy? Hi, I'm Bill Lewkowski, and I'm an independent Medicare insurance broker. And today I want to talk about the most popular Medicare Supplement policies. So if you're new to Medicare, or even if you've been on Medicare for quite some time, you'll know that there are two options to receive your Medicare. You can go with original Medicare Parts A and B, and most people will add a Medicare Supplement or what's called a medigap policy to that. The other option is to go with a privatized version of Medicare called Medicare Advantage. So the two most popular plans are a Plan G and a Plan N. So what are the differences? A Medicare Plan G will cover all of your out-of-pocket costs with original Medicare, all your deductibles, co-pays, and co-insurance after you pay the Part B deductible. A Plan N is almost identical. There's really only two other things that are different between a Plan N and a Plan G. But then you also will have some co-pays if you see a doctor or if you go to the emergency room. So you'll have a co-pay of up to $20 if you go to a doctor visit. And then you would also have a $50 copay if you went to the emergency room. The second thing that's different between a Plan N and a Plan G is it won't cover Part B excess charges. A Part B excess charge is where a physician determines that they're going to charge higher rates and not accept the standard Medicare rates. And it's a very rare occurrence. About 99% of the time, you will not run into an excess charge. Only less than 1% of people will actually see an excess charge. And the most it could be is 15% above Medicare rates anyway. So it's a very, very low risk. And so that's why I recommend a Plan N. I myself am on a Plan N. It's a great value, and I do recommend it for most people between a G and an N. N is almost identical, but it will be a good bit cheaper per month. It'll be less costly and be a great value. I just helped a gentleman that's been on a Plan G for a number of years. He's paying hundreds of dollars per month. We had him go through medical underwriting. He passed that, and he was able to get on a Plan N at a substantial savings. And it just worked out great for him. And it's something that can be done for anyone that's on a Medicare Supplement. If you've been on one for a while, you can shop for a new Medicare Supplement. You would do that by reaching out to an independent Medicare insurance broker like myself who can guide you through the process. And then if you pass medical underwriting, you will get the benefit of a substantial cost savings.